Our next speaker is Kuldip Sembhi, HCV Elimination Program Lead from MSD.
Afternoon, everyone. My name's Kuldip Sembhi from MSD. I'm National Partnerships Programme Lead. I've been with the programme right from the beginning, right when the negotiations were being made for the strategic tender, managing a fantastic team of project managers that are deploying our solutions. And I'm also joined here today by Ray, who's going to also do a presentation. Thank you. That is me. I first came in and looked at the agenda and I thought, great, we have lunch at 12:45 and then we finish at 13:45 with a quiz. I thought, great, I can go home and have a bit of a nap, and then turn the page and I thought, oh my goodness, I'm on the agenda. But I'm glad Ray's here as well. Right, and there's me. So just as a little bit of a reminder, these are the 4 solutions that we submitted as part of the our elimination initiative. So we're point of care testing, and this is where we provided 25 Cepheid machines. And I know some of you have used them, and they've been rotating around the ODNs too. So we have a few different models where we can get them in and out of prisons, into drug and alcohol treatment services, outreach, and mobile vans. We have a patient search identification tool, which Mark alluded to. I'm going to focus a little bit about primary care because that is where we're focusing a lot of our attention and energy for the rest of this year. This tool is available in 100% of practices in the whole of England. So whether the practices use System 1, EMIS or Vision, they all have access to this tool. Thirdly, we have the peer-to-peer programme, which we work directly with the Hepatitis C Trust, and we have 13 peer manager posts, and we have 3 of the South Asian peer roles as well. And again, you've already know the feedback from those, phenomenal activity. And we also have community liaison officer roles. Ray has changed his title, and he will explain the reason why he's changed his title. But we have 3 ODNs that use those roles, and the whole purpose of this role was to align and coordinate services across a wide range of different stakeholders involved in the elimination of hepatitis C. But for the rest of this very short presentation, I'm going to concentrate on our primary care search identification tool, because I know over 50% of you voted right at the beginning of the day that primary care services should be an area of focus for case finding. So what we're really going to be doing is around raising education and raising awareness in primary care. And the way we've been doing that is through sponsoring speaker sessions at best practice conferences. We've had a webcast into primary care, which we will repeat in October. And we also have a clinical pharmacist congress in September and October. So Mark and Grace Petoni, who you saw on the video, will be speaking at those national conferences. So this is a way of getting in front of a primary care audience, because we need to make Hep C elimination a part of everyday conversation in mainstream healthcare. So not just something that's spoken about in prisons, in drug and alcohol treatment services, in outreach, but in primary care too. And that's the ambition and the strategy for communication. We also have primary care communication channels. So we have a database of GPs that have consented to receiving information from MSD. So they've ticked the box to say that they subscribe to information. So we've been able to send them various messages about the Hep C elimination programme with links to the Hep C Trust, to the British Liver Trust, to various organisations where they can get more information and where they can get support around, again, education and raising awareness, including the Royal GP module as well. Sorry, not the Royal College of GPs module on Hep C and Hep B. So we have all those links within the email campaign. And they've performed quite successfully. So the first one we sent out had a 53% open rate, and that was to over 3,500 GPs. The second one, we changed the title slightly and we put liver disease. And Hep C elimination, I had a 68% open rate. And then we also sent an email out to clinical pharmacists who have a very specific role in primary care network. So each primary care network has at least one dedicated clinical pharmacist in primary care, We sent out, again, email campaign to those, and again, there was a 68% open rate, which continued into a click-through rate. So we know that these communication campaigns are successful, and we will continue those throughout the remainder of the year. But it doesn't just stop there, because amongst that then is, well, what happens next? There's a real call to action to work with the GP champions to contact the local ODNs. So they're not just doing this on their own. There's a big network of support around them where they can access the tool, run the tool, and work with the operational delivery networks to manage the patients and caseload. We're also looking at partner communications. So again, this isn't us just doing this on our own, because we believe in terms of sustainability and maintaining elimination, we have to work with other partners, including the British Liver Trust, the Royal College of GP, and some of our clinical system providers like EMIS, who has a real outreach into primary care. So we're working collaboratively with them too. And social media. EMIS Pathway, again, working with EMIS. We've also launched a report, which is Integrated Approach to Case Finding in Primary Care, and that's been launched. And again, our area of focus this year for World Hepatitis Day was also a focus on primary care and case finding. So a lot going on. And if you want my details, they should be on that QR code. You can just point your phone and my details will magically appear on your phone like black magic. But I am now going to hand over to Ray, who will talk about one of the roles that we funded is the Community Liaison Officer role. And I'm going to introduce Ray because some of you know I am a Liam Neeson fan. And Liam Neeson, as you know, in Taken, has a very specific set of skills. So this is Ray. He will look for you, he will find you, and he will treat you.
Thanks, Kuldip. How do I change it?
Just press enter.
Good afternoon, everyone. My name's Ray Cottington. In here today, I'm the Community Liaison Officer. If I'm out doing outreach at a testing event, I'll be a community engagement lead. Reason being, my first testing event, a couple of people thought I was CID because of the officer on my badge, so I quickly changed it when I'm out in the community. So I'm part of the peer team from the Leicester ODN. I'm here today to give you an update on the peer-led pharmacy testing that we was doing at Regent's Pharmacy in Northampton. I'm going to be presenting phase 1, the results and the conclusion, phase 2, the results and the vision for phase 3. So phase 1, I presented this last year, so I'm not going to go too deep into it. We first went to Regent's Pharmacy to test all NSP and OST patients there in September 2021. We tested 172 people for antibodies. We found 78 antibody positive. That works out 45% of the total tested. From that, we found that 26% were 26 of the antibody positives were RNA positive. So that works out 20. That was 17 new infections, 3 reinfections. All 20 were referred to treatment and all successfully completed treatment and all SVR'd. I wish that was as easy to do as it was to just say. So this is really where the partnership working come in to play. We worked very closely with CGL to sort of trace and maintain relationships with the patients. The pharmacist team were also helping us, letting us know when our patients were there so we could go and engage them. All we wanted as a peer team was a face-to-face meeting or some sort of contact, further contact with the known positives. To give you an example, 3 to 6 months, 70% of those 20 were either started treatment or completed treatment. The remainder, one example, it took us a year of consistently, if you like, walking hand in hand with the patient until they was ready to have treatment. So it took a long time before we got the final one, and it took us a year. So it was a lot of work to finish that off for us. Moving into phase 2. So we went back 18 months later, in February this year. Again, it was over 5 consecutive days. This time we had the access to the Hep C van. So the van was parked outside. We had 2 nurses come from Northampton General Hospital to do liver screening and other health checks. The pharmacist team actually got involved doing BMI and blood pressure checks. We wanted to upscale a little bit to see what we could do there. Anyway, we tested 102 people this time. 36 patients from phase 1 were also retested in phase 2. So that was a bit disappointing for me. I expected to test all of them again 18 months later. So at the time it was a disappointment. Since we've had the data from the needs assessment, we've give CGLD those in service list who were in service a year ago. Across our ODN, we're seeing that 70% are not in service anymore. So that kind of marries up with the figures I've got there. Anyway, back to the results. So out of the 102 tested, 37, that's 36%, were antibody positive. Out of those 37, we found 35 were RNA negative. That was 3 SVR12s, 26 SVR48s, and 7 we found that had self-cleared. We only found 1 RNA positive this time. He was previously known to service, and he refused treatment, so that's a work in progress. The good news is this time we had no reinfections. This is a survey that we done at the time. I'm not going to go into all the questions. I will say about number 7, would you like general health alongside your hepatitis C testing? Fortunately, 85% said yes. That was great news because that was the plan for phase 3. So I'm glad they said that. Phase 3, we had a meeting with Public Health Northamptonshire to extend the NHS health checks within the pharmacy setting to include Hep C testing to normalise it. The pharmacy has since been commissioned to provide screening and general health checks. They're delighted as well. The next pharmacy hit should be March 2024. We're going to repeat that on a 12-monthly basis. We're going to draw more data from this project. We're going to learn more from the project. We're going to go continued education, awareness drives. We're going to prevent reinfection. We're going to reduce stigma, and we're going to keep the conversation open about hepatitis C. We're going to expand this to a wider pharmacy setting across the network as well. We want to maintain what we've started here. And I think I will leave it there. Thank you.
So just a quick one, just to say this is such a great example of where this project was just supposed to be Hep C testing in pharmacy, but you can see how it's now evolved over the last 3 years into providing liver services, including Hep C testing. So it makes it an everyday test for everyone. So having the right person with the right skills in the right place at the right time really makes a difference. So thank you.